Welcome to the online education series for general practice nurses. My name is Teresa Lowry-Lanin. I'm a member of the Carlow branch of the IPNA. Today we're going to talk about measles, mumps and rubella, which are vaccine preventable diseases, and the importance of the MMR vaccination. Measles, mumps and rubella are vaccine preventable viral diseases, and they're spread by close contact with an infected person. They're highly contagious viruses, and humans are the only natural hosts. The MMR vaccine, which is an attenuated live virus, is immunogenic, and it offers long-term immunity for most people who receive the 2 recommended doses. MMR vaccine is administered at 12 months of age and at 4 to 5 years of age as part of our childhood immunisation programme. The full course offers 99% protection against measles, 95% protection against rubella, and 88% protection against mumps. Measles, properly known as rubeola, is an RNA virus. It belongs to the morbillivirus genus, which is part of the Paroxymyxoviridae family. It's an acute viral illness characterized by high temperature, cough, rhinitis, sore throat, conjunctivitis, and an erythematous macupapular rash, which usually first appears behind the ears and spreads to the face, limbs, and trunk over 3 to 4 days. Transmission is by direct contact with infectious droplets or airborne spread when an infected person breathes, coughs, or sneezes. The incubation period ranges from 10 to 12 days, and the exposure to rash onset averages at 14 days. The range is normally 7 to 21 days. Measles is highly contagious, and one case can infect up to 12 to 18 unvaccinated people. Up to 30% of measles cases result in 1 or more complications, but this is more common in the under 5s and the over 20 years of age. Complications include otitis media, diarrhea, pneumonia, convulsions, encephalitis, subacute sclerosing panencephalitis, and death. Those at increased risk for developing severe illness and complications include infants less than 12 months of age who are unvaccinated, pregnant women without immunity, and people who are severely immunocompromised. Mumps is caused by an RNA virus which belongs to the Rubella genus, classified in the Paramyxoviridae family. It's an acute viral illness characterized by swelling of the salivary glands either on one or both sides of the face. Complications include deafness, meningitis, encephalitis, pancreatitis, and sometimes orchitis, which rarely can lead to sterility. Transmission is by airborne or droplet infection, direct contact, or fomites. The incubation period for mumps ranges from 14 to 25 days, and it's approximately 17 days. Individuals are infectious from approximately 6 days prior to 10 days post the onset of symptoms. The maximum infectivity is 2 days prior to 5 days post the onset of symptoms. High-risk groups include preschool children, schools and third-level colleges, healthcare workers, international travellers, and those in close contact environments. The MMR vaccination is the best protection against mumps. 2 doses of the vaccine provide approximately an 88% reduction in risk, while 1 dose provides approximately a 78% reduction in risk. Rubella, commonly known as German measles, is an RNA virus in the genus Rubivirus within the Togaviridae family. It's a mild infectious disease, most common in young children. Up to 50% of infections are asymptomatic. It causes a rash which is transient, enlarged lymph nodes, and occasionally joint pain in adults. The rash is an erythematous maculopapular rash which initially occurs on the face and neck. The incubation period is approximately 14 to 21 days, with most people developing the rash at 14 to 17 days after exposure. It's most infectious from 1 week prior to 1 week post the onset of the rash. Contracted during early pregnancy, rubella can result in damage to the fetus. Features of congenital rubella syndrome include visual and hearing defects, CNS, and congenital heart defects. Deafness is the most common and sometimes the only manifestation, especially when infection occurs after the 16-week gestation. Risk of congenital rubella syndrome depends upon the stage of pregnancy. Up to 85% of infants infected in the first 12 weeks of gestation will be affected. The risk is approximately 50% from 12 to 16 weeks and 25% from 16 to 20 weeks gestation. So just a little bit about the background to the MMR vaccination. The monocomponent measles vaccine was first introduced into the National Immunisation Schedule in Ireland in 1985. Following its introduction, the number of cases of measles significantly dropped. In 1985, there were 10,000 cases, and in 1987, we had 201 cases. Rubella vaccine for prepubertal girls was first introduced in 1971 in Ireland. The rubella virus continued to circulate among younger children and older boys, however, and pregnant women continued to be exposed to rubella. So the vaccination policy was changed in 1988, and both boys and girls were vaccinated with the MMR vaccine. Vaccination against mumps began in 1988 with the introduction of the MMR vaccine, and that was the same year that mumps became a notifiable disease. In 1992, a second dose of MMR vaccine was recommended at age 10 to 14 years, but subsequently the age of that second dose was lowered to 4 to 5 years in 1999. Globally, measles vaccination resulted in an 80% decline in measles-related deaths between 2000 and 2018, preventing an estimated 21 million deaths. During the period 2001 to 2018, 2,837 cases of measles were notified in Ireland. Despite the availability of a safe and effective vaccine, the number of measles cases has risen significantly since 2016, and in 2017 there were 110,000 measles deaths worldwide, mostly among children under the age of 5. Approximately 95 to 98% of individuals develop immunity to measles after one dose of the MMR vaccine. Over 99% who receive 2 doses of the measles vaccine at 12 months of age and greater than 4 weeks apart develop immunity, which for the majority of people is lifelong. Breakthrough infections are rare and generally milder than in unvaccinated cases. Non-vaccination or incomplete vaccination increases the risk of mumps. It can also occur in a minority of people who have received the vaccine, however, the illness is less severe than those who have been vaccinated. From the beginning of 2019, for the first 12 weeks, there was a marked increase in mumps notification in Ireland compared to the same time period in 2018. 278 cases of mumps were reported in the first 6 weeks of 2019, compared with 43 for the same time frame in 2018. The mumps outbreak in Ireland, which began in 2018, continued to spread, affecting mainly teenagers and young adults in most regions across the country. But unsurprisingly, the number of cases declined in early April of 2020 following social distancing and a range of measures introduced in response to COVID-19. The MMR vaccine has been subject to controversy over the years, and it was the subject of a vigorous campaign of opposition based on the now discredited research carried out by the now disbarred Dr. Andrew Wakefield and his anti-MMR vaccination activism in the late 1990s. The research carried out by Wakefield and his team falsely claimed a link between the MMR vaccine and autism and inflammatory bowel disease. Publicity around this caused a sharp decline in vaccination uptake, leading to a number of major outbreaks of measles and measles-related deaths globally. At least 17 major trials have been carried out and looked at Wakefield's findings, and no reputable evidence has been found to link MMR to autism or irritable bowel disease. Despite the absence of any scientific basis for the claims, uptake of the vaccine fell dramatically, and we have repercussions still remaining today. MMR vaccine uptake rates in Ireland and globally dropped sharply in the years following Andrew Wakefield's claims. Although discredited, his claims were fueled by the anti-vax movement and parents' groups and spread through the advent and rise of social media. This resulted in large numbers of today's teenagers and young people in their 20s being unvaccinated in childhood. At the height of the MMR vaccine controversy, the uptake of the vaccine in Ireland dropped to 70% before it started to slowly recover. Thanks to recent targeted campaigns, including the positive use of social media by the HSE-NIO, we are now seeing a reversal of these negative trends, and levels of MMR vaccine uptake are once again increasing and continue to rise. In 2019, MMR uptake stood at 92%. However, this still falls short of the 95% target. The proportion of 5-year-olds who received the MMR booster in 2019 was 88%. It is recommended that older children and young adults who have not received 2 doses of MMR vaccine or who are not sure if they have should be vaccinated as soon as possible. It is important that people are aware of the pitfalls of relying on ill-informed and unreliable sources of health information and receive the facts and reliable information and data about the benefits and safety of the MMR vaccination from regulatory government bodies, the HSE and healthcare professionals. More than 500 million doses of MMR vaccine have been given in over 90 countries over the past 30 years. The World Health Organization and experts from around the world agree that there is no link between the MMR vaccine and autism or inflammatory bowel disease. Some individuals who get 2 doses of MMR may still get measles, mumps or rubella if they are exposed to the virus. The reason around this is still unclear, but it could be that their immune system did not respond fully to the vaccine, or their immune system's ability to fight the infection decreased over time. Symptoms when they occur in vaccinated people are usually much milder. While the MMR vaccine is considered safe, it should not be given in cases where the person has had an anaphylactic or severe reaction to a previous MMR vaccine or any part of the vaccine, or a severe allergic reaction to neomycin. The vaccine should not be given to pregnant women, and pregnancy should be avoided for 1 month after the MMR vaccination because of the theoretical risk live vaccines pose to the fetus. Administration of the MMR vaccine should be delayed in instances where the child or individual has a fever, had varicella vaccine within the previous 4 weeks, received recent blood or blood products, is on high-dose steroids, is undergoing chemotherapy or radiotherapy, has any illness affecting the immune system, or is receiving treatment with protopic ointment for severe eczema. The MMR vaccine is not contraindicated in individuals allergic to egg. The vaccine does not contain significant amounts of egg cross-reacting proteins, and recent data suggest that anaphylaxis following MMR is not associated with hypersensitivity to egg antigens. In early 2020, the HSE began offering free doses of MMR vaccine to 11 to 30-year-olds as cases of mumps continue to rise in Ireland. Secondary schools and third-level institutions have seen a high incidence of mumps. During 2019, the number of mumps cases continued to rise, and we saw 2,762 cases compared with 573 the previous year. 253 cases had already been notified to the HSE by the 21st of January 2020. At the moment, 91% of children in Ireland have received one dose of the MMR by 24 months of age. While this is considered a good uptake by international standards, it is below the target of 95% to prevent cases of measles and measles outbreaks occurring. So I'll just tell you a little bit about the Global Vaccine Action Plan. In 2012, the Health Assembly endorsed the Global Vaccine Action Plan with the objective of eliminating measles in 5 regions by 2020. By 2018, the move to improve vaccine coverage globally resulted in a 73% reduction in deaths, and approximately 86% of the world's children had received one dose of measles vaccine through routine health services. That was up 14% from 72% in 2000. 2 doses of the vaccine are required, however, to ensure immunity and prevent outbreak, as approximately 15% of vaccinated children fail to develop immunity from the first dose. In 2018, 69% of children received the second dose of measles vaccine. Based on current trends of measles vaccination coverage and incidence worldwide, the World Health Organization's Strategic Advisory Group of Experts on Immunization, known as SAGE, concluded that measles elimination is greatly under threat, and the disease has resurged in a number of countries that had achieved or were close to achieving elimination. Routine measles vaccination for children combined with mass immunisation campaigns in countries with high incidence and death rates are key public health strategies to reduce global measles death. Because of low coverage, multiple regions globally were hit with large measles outbreak in 2018, causing many deaths. In Europe, 90,000 measles cases were recorded in the first half of 2019, more than all of the cases recorded for 2018. So what can we as healthcare professionals do? Well, without sustained attention, advances and hard-fought gains in vaccination programs and uptake can easily be lost. When children are unvaccinated, outbreaks occur. So evidence-based solutions are important in the fight against the resurgence of vaccine-preventable diseases. We must take every opportunistic discussion in practice with patients to help reinforce the importance of vaccination programs and adherence to the recommended schedules. Providing vaccine education to pregnant women and their partners can help increase their knowledge, vaccine uptake, and the timeliness of receipt of childhood vaccinations. Discussions involve addressing parental concerns about the MMR vaccine safety, and that includes purported links to autism, immune system overload, and the perception that vaccine-preventable diseases no longer exist. Nurses and doctors in third-level healthcare centres are well placed to advise students who are unvaccinated as children on their options and the benefits and importance of vaccination. It is important that practice nurses and clinicians are up to date on research and immunisation guidelines, and that we're able to communicate effectively the benefits and importance of vaccination. Effective communication techniques, providing evidence-based information and best practice advice, can address misconceptions and gaps in patients' knowledge, leading to informed choices, better patient education, and improved outcomes. For reliable and up-to-date information about HSE immunisation programmes, visit the HSE NIO website. I'll just show you the link here. So this is a list of all the references that were used in the production of this presentation. I hope you have enjoyed it. All the links are active. Feel free to look for more information by clicking on. I would like to thank you today for watching and listening to this presentation, which is part of an online education series for general practice nurses produced by the Irish Practice Nurse Association. My name is Teresa Lowry-Lanin and I'm a member of the Carlow branch of the IPNA. Thank you.